Today I am Jasmine Karen Emilinas, a first-year nursing student in St. Public Colleges. So I am here to perform the assessment of outcome. So before I came here, I already washed my hand and provide a client's privacy. So next is I will position a client to a spine position to conveniently assess the abdomen. Okay, sir, kindly. I position you in a supine position in which your abdomen is exposed. Are you willing to cooperate with me? So, during the assessment, observe the client's face constantly for pain environment. So, first, I will observe the abdomen from the ribs down to the symphysis gluteus. And I will examine the shape, size, contour, presence of skin lesions, scars, bulges, and symmetry of the abdomen. So the shape of the patient's umbilicus is flat and exerted. The size and contour are flat to round. So there is no presence of lesions, scars, and bulges. The abdomen of the patient is symmetrical to the chest, and the skin of the patient is smooth and even color. So next is I will assess the umbilicus. So the umbilicus of the patient is inverted and it is in midline coinciding with the mid-sternal line. So next is I will measure the abdominal girth with a tape measure. So place the tape measure on the umbilical line throughout the posterior and anterior. So the abdominal girth of the patient is 75 cm. So next is I will use tape for the 4 quadrants for vowel sounds using the diaphragm of the stethoscope beginning with the right lower quadrant. For vascular sounds using the bell of the stethoscope in the aorta, renal arteries, iliac arteries, and femoral arteries. presence of gargling sounds in each quadrant showing of a normal signs, and there is no signs of any abnormal sounds. And now I will perform percussion on the right lower quadrant starting on the mid-clavicular line, going downward, and repeat the procedure on the other side. Lower pitch and hollow sound, which is normal response. So next is I will percuss for the liver on the right side. So sir, may I ask you to turn to right side or right lateral position, and I will percuss it. For 5 minutes before percussing. This is percuss to split, and I will begin from the 6th string on the left side. And also percuss on the lowest intercostal space by asking the client to take a deep breath. So it produces dullness, which is a flat sound, and no signs of any diseases such as hepatomegaly and splenomegaly. So next is I will do light palpation using the pads of my fingertips, beginning with the non-tender quadrant. So gently press 2 cm in a dipping motion and move to the other areas. Deep palpation at about 4 cm and also move it into the other areas. So while doing the light and deep palpation, the abdomen of the patient is soft and no organomegaly or masses and non-tender. So next is I will palpate the kidney on each side of the abdomen using bimanual palpation. Signs of any enlarged kidneys and tenderness. So next is I will palpate the liver on the right part of the body So the spleen is normally not palpable. So next is I will do the palpation for the umbilical area for swelling, bulges, or masses. So the patient has no signs of any bulges or masses, and there is no presence of swelling. So that's all on how you assess the abdomen. Thank you.